Coming from Chicago to tell you about an ARTAS case. I do a lot of hybrid surgery. That means ARTAS plus my own hand, where I'm the artist. I use a 0.8 to a 0.85 punch, and I'm able to get down at the nape of the neck. We use this nape of the neck here for the hairline and the temples. This is my patient, Billy, and he's about a year out from surgery, right?
About a year, yeah.
Yeah. And so no one's seen your pictures before, but all this hair up here is graft hair, and you wear your hair pretty short, right?
I do.
Has anybody said, hey, Billy, what's up with your hair? Are you growing hair? Are you losing hair? They said anything about your hair?
Nobody's noticed any that I had any procedure done at all.
Good. What about your parents?
They don't even know I had any procedure done yet.
Well, I'm going to take that as a win, that we've done something at least natural, because people in the world today are not nice people. When I used to have this big strip scar in the back of my head and standing in the grocery line, I can't tell you how many times people would say, hey, what happened to you? Didn't know these people at all. And before I would mention about the hair transplant, you have some fancy story, but it's just better to say, hey, I had a hair transplant, what's the big deal? So turn around, let's see the back of your head. Here, we did about, 1,800 grafts?
About 1,800.
1,800 grafts to the frontal area. Down here is my 0.8 punch, and you can barely see anything going on down here, which is really good. If you did a 1.0 punch down here, you'd see it. Up through here is the artist with a 0.9 millimeter punch. Can't see anything here too. So overall, I'm going to say this is a win in that you can't see anything in the back. The front looks good. So a lot of patients, you can turn on, Billy, a lot of patients I see on the forums, they say, hey, I want to get the best. I want to get a strip. I'm going to get a strip, and then I'm going to get FUE. I think that's very foolish, because a scar is a scar, and dealing with the remnants of a scar can be much worse than anything ever. So I would not get a scar first and then do FUE. Let's look at your pictures before. This is you before, so I'm going to show you as well to make sure that we're not pulling a Photoshop or whatever they call that now. Okay, take a look at this. Is that you?
Yeah, that is me.
Okay, what do you think when you see that?
It looks wonderful. I'd do it again if I had to. I mean, it's
You look totally different.
Yeah, I do.
It looks like this is William's dad. I don't even know his dad, but that's what I would think your dad would look like. Oh, it's okay. Brain surgeons get calls. It's okay. It's good to be busy. But I say that's a remarkable result. So using the ARTAS 1,800 grafts, and we always kind of go from the hairline to the maximum point here, or the vanishing point, where if you plot on somebody's scalp where you can't see any further, we'll always kind of maximize the grafts in here. He still has some thinning here that we'll address. We're using non-surgical means here, but you don't want to waste a lot of hair in the back. You don't want to waste that at all. You always want to concentrate on what people see. A lot of people come in and say, Doc, I want to do it all, or I don't want to do nothing. That's a personal choice, but I think that's foolish if you're already thin here and, you don't want to improve this and you just want to, concentrate on this. I think that's very foolish, but that's a whole nother conversation. Bill, what would you say for people? I mean, was it a terrible thing? I mean, you've never seen a guy with a strip before, have you?
I have not, no.
Okay.
Yeah.
Good for you. Okay, and I hope you never see a guy with a strip.
I mean, I think the big thing is if you want to wear your hair short,